Hi everyone. For this lecture, we're going to still be covering the respiratory system, but now we're going to focus specifically on ventilation. As you learned earlier, the pulmonary circulation consists of blood vessels that will carry the blood from the heart to the alveoli of the lungs and then back to the heart. The lungs will then receive deoxygenated blood from the heart via the pulmonary arteries, and each pulmonary artery will branch into smaller pulmonary arterioles, which will give rise to even smaller pulmonary capillaries that are going to be surrounding the alveoli. And while near the alveoli, the blood in the pulmonary capillaries, they become oxygenated as it picks up oxygen and unloads some of its carbon dioxide. Now, oxygenated blood then enters the pulmonary venules, which merge to form larger pulmonary veins. And from the pulmonary veins, oxygenated blood is carried back to the heart, right over here on the left atrium. So this should not be new material. You guys should know all of this. Now, the pulmonary circulation has a high rate of blood flow, and in fact, blood flows through the lungs at a higher rate than in other tissues of the body because the lungs, they receive the entire cardiac output, and if you remember, is about 5 liters per minute that is ejected from the right ventricle of the heart. And recall that the same volume of cardiac output ejected from the left ventricle of the heart supplies all remaining body tissues, and that this cardiac output is divided among these tissues, causing each of them to have smaller rate of blood flow than the lungs. Therefore, the lungs, they will receive as much blood in 1 minute as all other tissues in the body during the same time period, because both ventricles will eject the same amount of blood. However, the one that's going through the pulmonary circuit has a shorter route than the one that's going through the systemic circuit. And although its rate of blood flow is high, the pulmonary circulation has a low resistance. And this is due to the fact that the blood vessels that are in the pulmonary circuit, they have a larger diameter, their walls are thinner, and they are more compliant, meaning that they're able to stretch more and accommodate the amount of blood that's circulating. And this just means that the blood flows more freely in the pulmonary circulation than it does in the systemic circulation. And because its resistance is low, the pulmonary circulation has a low blood pressure. And the lower pressure in the pulmonary circulation means that the right ventricle does not have to pump as forcefully for blood to reach the lungs. And this is because the lungs are right next to the heart. They're actually in the same cavity, right? They're in the thoracic cavity. Accordingly, the peak of the systolic pressure in the right ventricle is only 20% of that in the left ventricle. And this is why the left ventricle has a thicker myocardium, which is not really well represented on this image, but it does happen in our heart. Now let's start to talk about ventilation, which is the same thing as breathing. And this will be the mechanical flow of air into and out of the lungs. And 3 pressures are important for ventilation. We have the atmospheric pressure, the alveolar pressure, and the intrapleural pressure. The atmospheric pressure is the pressure of the air in the atmosphere, like the name says, which at sea level is about 760 millimeters of mercury, or 1 atmosphere. In the alveolar pressure, this is going to be the pressure of air within the alveoli of the lungs. So within the tissue itself, the organ itself. And depending on the stage of the breathing cycle, it will be either equal to, lower than, or higher than the atmospheric pressure. And air flows into or out of the lungs because a pressure gradient will exist between the atmosphere and the alveoli. So air moves into the lungs when the alveolar pressure is lower than the atmospheric pressure, and moves out of the lungs when the alveolar pressure is higher than the atmospheric pressure. Makes sense, right? So the movement is going to occur from the higher pressure to the lower pressure. And lastly, we have the intrapleural pressure, which is the pressure within the pleural cavity. Remember that the pleural cavity is going to be that space between the parietal and the visceral layers of the pleura. And there's going to be a small amount of intrapleural fluid that is going to be present in this space. Now, the intrapleural pressure is always a negative pressure, meaning that it's always lower than the atmospheric pressure. So ranging from about 754 to 756 millimeters of mercury during what we call a normal quiet breathing. Now, because the pleural cavity has a negative pressure, it essentially functions as a vacuum. This mechanism of suction, it actually holds the lungs against the chest wall to form what we call the lung-chest wall system. And this just means that if the thoracic cavity increases in size, then the lungs also expand. If the thoracic cavity decreases in size, then the lungs will recoil, they will become smaller. Therefore, the lungs will fluctuate according to the space inside of the thoracic cavity. Now, these changes in lung volume, they're caused by alterations in the thoracic cavity size, and in turn, it causes a change in the alveolar pressure. Therefore, if the lungs expand, the alveolar pressure will decrease, and when the lungs recoil, then the alveolar pressure will increase. Now, our respiration or breathing goes through cycles, and there are 3 phases to this cycle, which are the rest, inspiration, and expiration phases. First, this rest phase is actually very short, and during this phase of the breathing cycle, the alveolar pressure is actually equal to the atmospheric pressure. And because a pressure gradient does not exist between the atmosphere and the alveoli, then the air does not flow into or out of the lungs. It basically stays stationary. Now, during inspiration, which is also called inhalation, and this is when you're breathing in the air, this means that the air will flow into the lungs. The alveolar pressure must become lower than the atmospheric pressure, and this condition is going to be achieved by increasing the volume of the lungs. Therefore, your chest will expand, and this will allow your lungs to increase in volume, and therefore this allows the air to flow into the lungs. Now, the opposite will occur during expiration. So this means when you're breathing out, which can also be called exhalation, and this is also due to a pressure gradient. But in this case, the gradient is in the opposite direction, meaning that the alveolar pressure is greater than the atmospheric pressure. And unlike inspiration, the normal expiration during quiet breathing is actually a passive process because there are no muscle contractions that are going to be involved. And instead, the expiration results from the elastic recoil of the chest wall and lungs because they do have elastic fibers. So this means that the chest wall and the lungs both will have this natural tendency to basically spring back after they have been stretched. In fact, 2 inwardly directed forces will contribute to this elastic recoil. The first one is what I talked already about, which the recoil of the elastic fibers that were stretched during inspiration will go back to place. And then the next one is that there is an inward pull of the surface tension due to the film of the alveolar fluid. And we already saw that surfactant is the substance that will help with the surface tension. Here we can also talk about respiratory rate, which is the number of breathing cycles that occur per unit of time. And this is usually expressed in breaths per minute. So in an average adult at rest, the respiratory rate is about 12 breaths per minute, and each breath is going to be equivalent to one breathing cycle. And a breathing cycle is one inspiration and one exhalation. So just to recap, here we have a breathing at rest, which, like I said, is a very brief phase. And notice how the alveolar pressure is 760 millimeters of mercury, which is the same as the atmospheric pressure. So there's no gradient or pressure gradient, and therefore the air will not move. So it does not go into the lungs or it does not go out of the lungs. It stays stationary. I want you to also notice how the diaphragm, which is the muscle that separates the thoracic cavity from the abdominal cavity, is relaxed during the rest phase. For inspiration, we can say that the pressure of a gas in a closed container is going to be inversely proportional to the volume of the container. So this basically means that if the size of a closed container is increased, then the pressure of the gas inside the container decreases. And that if the size of the container decreases, then the pressure inside will increase. And this inverse relationship between the volume and the pressure is actually called Boyle's law. And it may be demonstrated using this image as follows. So suppose there is a gas that is placed in a cylinder that has a movable piston and a pressure gauge, and that the initial pressure created by the gas molecules striking the wall of the container is 1 atmospheric pressure. If the piston is actually pushed down, as we can see over here on the right, the gas is going to be compressed into a smaller volume so that the same number of gas molecules will strike less wall area, as we see over here. Notice how the reading on the gauge increases, and it's actually showing the increase in pressure as the gas is compressed to half of its original volume. In fact, it actually increases to double the pressure. In other words, the same number of molecules in half the volume produces twice the pressure. Conversely, if the piston is actually raised to increase the volume, then the pressure decreases. And therefore, we can say that the pressure of a gas will vary inversely with the volume. So therefore, for you to be able to inspire air, to get more air into your lungs must be able to expand, so they must be able to increase the volume. And therefore, if you're increasing the volume, then the alveolar pressure will fall below the atmospheric pressure, and this allows the air to enter into the lungs. The differences in pressure that's caused by changes in the lung volume, they will force the air into our lungs when we inhale, so when we breathe in, and out when we exhale or we breathe out. And for inspiration to occur, the lungs, like I said, they must expand, which increases the lung volume and thus decreases the alveolar pressure to below the atmospheric pressure. And the first step in expanding the lungs during normal quiet inspiration actually involves the contraction of the main muscles for inspiration, which are two, the diaphragm and the external intercostals. And the most important muscle of inspiration is going to be the diaphragm. It is a muscle that's innervated by fibers of the phrenic nerve, which originates in the cervical plexus, and contraction of the diaphragm causes it to flatten, lowering the dome. So we can see here from this image, this blue line is representing the diaphragm, and when it contracts, like I said, it moves the diaphragm down. And by moving it down, it actually pushes all the abdominal organs closer together, and this increases the volume of the thoracic cavity. So contraction of the diaphragm is going to be responsible for about 75% of the air that enters the lungs during what we call a quiet, relaxed breathing. Now, if you have advanced pregnancy or excessive obesity, for example, or even if you're wearing these very tight clothes that squeezes all your abdominal organs, this can prevent the diaphragm from moving down, and therefore it makes it harder for you to be able to breathe because your thoracic cavity cannot expand to accommodate the expansion of the lungs. Now, the next most important muscle of inspiration are the external intercostals, which they do extend between the ribs, and that's why they're called intercostals, between ribs. And they are going to be innervated by what we call the intercostal nerves, so it makes sense. And when the internal intercostals, they contract, they actually pull the ribs upward and actually outward as well. So this will also help to increase the volume of the thoracic cavity. Now, contractions of the external intercostals are going to be responsible for 25% of the air that enters the lungs during normal, quiet breathing. So 75% for the diaphragm, 25% for the external intercostals. This makes 100%. So these are the only two muscles that will help during inspiration when we are performing normal, quiet breathing. And as the volume of the thoracic cavity increases with the contraction of the diaphragm and the external intercostals, the volume of the lung increases as well, and the alveolar pressure drops from 760 to 758 millimeters of mercury. And this pressure difference is going to be established between the atmosphere and the alveoli. And because the air always flows from a region of higher pressure to a region of lower pressure, inspiration will take place. So air continues to flow into the lungs as long as a pressure gradient exists. Also notice from this image how contraction of the diaphragm will move the diaphragm down, and therefore it will allow a bigger space for the lungs to be able to expand. Moving on to expiration, it will start when the inspiratory muscles relax. So when the diaphragm relaxes, then it will form the dome shape, as we can see right over here, because it will have this elasticity that will move it back into place. And as the external intercostals relax, the ribs are going to be depressed, so the ribs are going to be moving down. And these movements, they decrease the volume of the thoracic cavity, which decreases the lung volume. And in turn, the alveolar pressure will increase to about 762 millimeters of mercury. And this means that the air will be able to flow from the area of higher pressure in the alveoli to the area of lower pressure in the atmosphere. And during this normal breathing, no muscles will help with this, because what's occurring is just a relaxation of the two muscles that help with inspiration, which again are the diaphragm and the external intercostals. However, expiration becomes active only during forceful breathing. And this occurs while playing, for example, a wind instrument or doing exercise. And the muscles that will help with this forced expiration are what we call the accessory muscles. And they are listed here. We have the rectus abdominis, the external and internal obliques, the transversus abdominis, and the internal intercostals. So let's look at them on the next slide. In the abdominal region, we're going to have three muscle layers. The one that's more external is what we call the external oblique. The one that's more internal is what we call the transversus abdominis. Notice how the fibers over here run transverse. And the one in the middle is what we call the internal oblique. Then right here down the midline, we have the rectus abdominis. These are your abs, like you guys like to call. And then we're going to have the internal intercostals. Notice how the internal intercostals, not only are they located more internally, so closer to the sternum, when compared to the external intercostals, which are located more laterally, but also notice how the fibers run in opposite direction. So the external intercostals, they run from outside towards the inside, and the internal intercostals, they run from the midline towards the lateral side. So this means that when they contract, they will do opposite functions. So again, the external, they will elevate the ribs. So that's how I remember that external starts with an E. So they will elevate the rib, and the internals, they will depress the rib. Also on this image, we can see how between the ribs, there's like a little line between these two muscles. So the one that's more superior is going to be the external intercostal, and the one that's deeper will be the internal intercostal.